Good morning. My name is Paweł Gromek. I'm the medical advisor in the field of cardiology in Polpharma.
Powiedzieć Państwu na temat
In few words, I'd like to tell you about the directions for the development of cardiology telemedicine in Poland. Those directions were actually described in two documents, first being the Baltic Declaration, establishing the main directions for the telemedicine in cardiology development for Poland. Then we had a more detailed document, Telemedical Solutions in Cardiology. This was an opinion prepared by experts of the IT and telemedicine experts committee and also by the committee of the Polish Academy of Sciences. In both documents, we have the following directions outlined: the telemonitoring of those devices which are actually implanted. This is one of the most important fields in telemedicine in cardiology because these are life-saving devices. Then the teleconsultations between patients and doctors, but also between doctors. This is when the primary care doctors would be able to consult the more difficult cases with specialists. Then the electrocardiographic telemonitoring, and that is in particular very important in the cases of chronic diseases. We need to be able to record the 30 seconds time spans in order to analyze the patients suffering from atrial fibrillation. So sometimes we need to monitor patients for over a long period of time, 30 days, for example, in order to achieve satisfactory results. However, we are not able to detect 100%. And then we should be able to monitor patients that had undergone treatment. We have the comprehensive program for patients who had suffered cardiac arrest. This has been financed by the National Health Fund. We offer both the long-term rehabilitation and treatment of patients. We managed to reduce the death rate in the first year after the episode by 31%. I'd also like to say that almost 30% of patients who suffered from myocardial infarction opted out. They said they do not have the time and they would need to travel to the treatment and rehabilitation centers. So this telemedicine solution, where patients could receive support at home, would be a good solution, in particular during the pandemic. Another direction for the development of telemedicine in cardiology, but not only, is the telemonitoring in terms of pharmaceuticals that are being administered in order to optimize the treatment. So we could have sort of mobile chart for a patient where all the information on recommended therapies and treatments would be introduced. There would be possible to supervise the patients from the level of application, trying to remind patients and make sure that patients actually take the medicine that has been prescribed. It would eliminate the over-treatment problem, meant as administering too many drugs or medicines from the same group prescribed by many different doctors. I had a case of a patient who received 2 beta blockers and 2 different statins prescribed by 2 different doctors. We would also be able to carry out certain tasks that doctors usually have no time for during consultations, that is educating the patients, explaining to them how important it is to take the medicines regularly and to follow the recommendations as to the change of lifestyle. There are also other platforms where telemedicine in cardiology should be developing. We should be able to measure actually the liquid levels for the patients suffering from the chest impedance. Patients who actually exceed the levels are risking hospitalization. And we are able to detect this early to actually identify the lack of balance and to avoid hospitalization. We are also looking at the non-invasive methods of body fluid balance analysis, and that would allow us to monitor these parameters. Can there be negative effects of the promotion of telemedicine in cardiology? Well, there are some traps indeed, both at the side of patients and the doctors, as well as the technical aspect. The sheer number of data or volume of data generated by telemedicine will be much greater than what now needs to be analyzed by medical professionals. Measurements will be taken more frequently, measurements could be more complex, and they can be taken for many more patients. And someone needs to actually look at these measurement and test results, these being specialists at the other end of the telemedicine system. And let me use the example of a German Telemed 5000 system for the patients who suffer from congestive heart failure. So there was doctors who actually analyzed the system with 200,000 patients connected, and that would require 200 telemedicine centers operating 24 hours per day, 7 days per week, which is financially not feasible. And artificial intelligence came to rescue here, because before the data is looked at by specialists, actually results are sieved through by the automatized system. Correct measurements are actually excluded, and then the incorrect measurements are prioritized. And also the diagnostic of atrial fibrillation is very important. For such episodes, it is very important to monitor patients over a long period of time. So the Mayo Clinic specialists ask themselves whether it is possible, whether a patient is at a risk of atrial fibrillation using the electrocardiogram from any given period. Artificial intelligence solution created by them uses hundreds of thousands of electrocardiogram readings and is able to establish whether a given patient is at a risk of atrial fibrillation. So then we could monitor those patients who are at a high risk of atrial fibrillation. Well, thank you very much. Thank you. My name is Jarosław Głażewski, and I am a director of the digital marketing department at Polpharma. digital marketing, which is targeting promotion of prescription drugs. So we use digital channels, digital solutions in order to reach people who are healthcare professionals with information on our solutions. I am a physician myself, so I have a certain knowledge about different ailments, illnesses, and the treatment methods. So also due to my age, I am a patient myself. Hypertension is, for example, something I need to be treated for. So I can consult certain solutions that we come up with as an active user. Today, I'd like to speak about a certain app that we have designed for both patients and physicians or other persons looking after persons who actually suffer from circulatory system diseases. These are diseases which should and need to be monitored. Well, in this actually circulatory system diseases, there is a certain aspect of self-checks or self-control that is very important, where access to physicians is so restricted. So we can actually, being a patient suffering from a cardiovascular disease, be monitored and self-monitor our health using this application. Its name is Cardiometr, and all information on this application can be found on the website cardiometr.pl. This application is to be used by patients and doctors who actually treat patients with hypertension. This application makes it possible to record the measurements of tension. It can be done manually using any device. There are also some devices that measure the blood pressure and can actually connect to this application, and they can record the blood pressure readings.
Well, in addition, you can also prescribe drugs dedicated to a given hypertension patient. You can measure your weight and compute your BMI. It's an index which makes a difference in hypertension patients because most of them are overweight. And one of the ways is to reduce your weight. In the app, you can record your physical activity, what supports hypertension or cardiovascular therapy. So what are the benefits offered by Cardiometr for the patient? Well, first of all, the patient doesn't have to carry or remember doesn't have to memorize, recent readouts. So there's no need to keep a diary because you had to keep paper diary in the old days. It was a common device. So you can download the app on any smartphone with iOS or Android. And you usually have your phone with you all the time, even during medical appointments. So access to medical records is easy, effortless, during your medical appointment when it's essential. You can share the data with your doctor. You can text it, you can mail it, and your physician is able to better monitor your therapy. If required, therapy can be modified in terms of doses or medication. And, hopefully this way we will be able to contribute to more effective monitoring and more effective therapy of hypertension patients.